Welcome back to the Painless Childbirth course. I'm Israel Maya, your host as always, and today we're going to be doing session number 7. Welcome back to my car, by the way, where we're going to be driving out to two professionals that are going to teach us things about postpartum. The first one is Barbie Levine. She is a licensed massage therapist, and she deals with infant massage specifically, so she's going to teach us the benefits of massaging your baby. And we're also going to be visiting Dr. Netta Shaked, and she is going to be teaching us about postpartum depression. Now, this is something that's very, very important for many women to listen to, so please sit back, invite other women to listen to this section as well, because it's important to know the signs of postpartum depression and what's entailed with that. I'm going to start my car now, and we're going to be heading off to the first part of today's session. This is Barbie Levine, and she is a certified prenatal massage therapist and an infant massage therapist, and she's going to explain to us today the benefits of getting massage before you have your baby, and perhaps even the benefits when you have your baby or after you've had your baby. Thank you, Barbie, for being with me today.
My pleasure.
Barbie, why massage?
Massage is a wonderful way to release stress, to bring in relaxation, and for a mother to get in touch with her child that she's carrying.
Can any woman come in here that's pregnant at any month, or at what point do they start coming in here?
Good question. I will only massage once a woman has completed her first trimester. Once that has taken place, there are questions I need to ask and learn about her. One, I need to know, is this her first pregnancy? And if so, I congratulate them. I need to ask them when they're due, and also, are there any complications that they've had? And if not, do they themselves have any medical conditions that I should be aware of? I want to know whether or not they're under 20 or over 35, because that's important. That would be considered a high-risk situation. I would want to know, do they have any heart conditions? Do they have any liver problems? Do they have any hypertension situations that are taking place? All these things are considered a high-risk situation. If that is the case, and even multiple pregnancies, if that's the case, it's not that they can't be massaged, but what's important is that they need the communication with their OBGYN or midwife to see if they would agree that a massage would be safe for them. And if so, then I would need a written release form from the doctor. And that's how I work it.
So it's not just, I want a massage and you take them.
No.
There are certain factors that are involved in getting massage.
Absolutely.
And there's safety also that has to be considered with the pregnant woman.
Absolutely. And even a woman who comes to me for the first time, I do a testing called DVT, which is deep vein thrombosis. And it's gently by palpitating on one leg either side to see if the temperature is the same on either side, which is what you want. If one side's hot, one side is cold of the same leg, that's an indication that perhaps a blood clot could be released. Not necessarily going to happen, but a possibility. The other sign I check is when I place my hand on top of their knee and their leg is straight out, I will flex and point their foot. If they have any pain in that leg from doing so, that's another indication. And once again, I stress to my mom-to-be that just because I'm testing them for this doesn't mean it's going to happen.
I think it's important for people that are watching to know that massage therapy is not just about manipulating the muscle or squeezing the muscle. There's so much more involved there. There's a release of tension, there's a release of stress, and as you were saying before, emotional things come up, and the massage therapist has to know how to deal with those emotional things up to a certain point, unless they've studied some type of counseling in the past. And I know that a lot of massage therapists are very, very well versed in many different areas, as you are.
Yes, yes.
Do massage therapists ever massage a woman while she's already in labor or while she is having her contractions? Is a massage therapist allowed to be in a hospital in the year 2010?
Of course, you have to get approval, but yes, that is possible. Have I done that? No.
Okay.
Mine is just within my own home. because I can control what I want to give to the women, which is a safe haven for them to feel as comfortable as they can to relax and let go. And so I've created that here, and it's very hard to duplicate that someplace else.
Let's talk a couple of minutes about infant massage. And once the baby is born, why is it important to massage an infant?
It's a great question. Let's go back to while a child is within the womb, inside the woman's body, every time the woman is moving, the child's in a combined area. So the movement makes them hit the walls. That's a form of touch for 9 months. Then contractions take place, and they go through the birthing canal, and that takes hours. But all those contractions, another form of touch. Then they're leaving this noisy, but also warm environment, and they're born into this vast space, bright lights, and it's not the noise that they're upset about, but it's temperature, and all of a sudden they may be swaddled, but that's it. There's no touch, not as much as they're accustomed to.
Yes.
So that is one of the reasons why touch is so important. Also, it is a beautiful way of bonding with your child. Many fathers are nervous about touching a newborn. It is a fabulous way for a father, and the bigger they are, the faster they falling in love with their child. And although they may be nervous when they're first here, within a short period of time, you can see the relaxation take over, and you see the joy coming out of the father towards their child. And when you do massage a baby, there's so many numerous health benefits for them. A child could be born full term, but yet their intestinal tract may be sluggish. Massage helps to tonify the intestinal tract, which helps to make the food go through the intestinal tract easier and be eliminated. There's some babies who are born with colic. They're labeled colic, which means gas problems most of the time. There's a special routine for that to help to relieve that. And if you're consistent, that could diminish within days or 2 weeks. Every child's different. It helps the central nervous system. It builds up the immunity. It makes the blood flow and the lymph fluid flow back into the heart easier. Their respiratory systems work better. Every system in the body works better.
There's a lot of benefits into infant massage.
Tremendous benefits.
Is it complicated to learn infant massage? If somebody that's watching says, well, wow, this really sounds like something I would like to do for my baby, and it sounds like everybody should do something like this for their baby. Is it hard to learn infant massage?
Not at all. Not at all. You can come to me. It'd be my pleasure to teach you. I just love what I do. It is just the most rewarding situation in seeing parents who are excited to know that they can help their child when the child needs help. If at a certain time of the day your child goes from a sweet child to a screaming meanie, that means that 1 hour prior to that set time that is typical, they go off, let's say 5 o'clock, this isn't the child that you've known, and you don't know what to do. Then at 4 o'clock, 1 hour prior to that time period, you give your child a bath, and then you massage your child. You stay consistent with that for a few days, and your child will learn how to get organized again. They don't know how to get themselves organized once they're out of once they're disorganized. They need help, and that's what the combination of a bath and a massage will do 1 hour prior to that time period of them losing it.
Beautiful. Is there anything you would like to say to the pregnant women that are listening to you today?
I wish you a joyful pregnancy, and I hope you are wise enough to give to yourself. We are so busy as women giving to others that you need somebody to nurture you during this time period. You will be a happier mom-to-be, wife, and maybe already a mother. And it would be my pleasure to be able to help you.
Thank you so much, Barbie, for being
My
with me
pleasure.
today. And I've learned so much, not only about massage, but infant massage.
Oh, it's a gift. Infant massage is a gift of a lifetime. You are giving your child not just a way to relax, but also teaching them that they are loved, that they have such self-esteem that you're giving them, and that it's positive touch, which every child should experience.
Beautiful. Thank you again.
My pleasure.
I had no idea how important infant massage can be. I'm so glad that we went to see Barbie, and you can practice on your infant baby. There's nothing that you can do wrong as long as you learn it from a professional. We're going to be heading out to Dr. Netta Shaked now, and she's going to be talking to us about postpartum depression. So stay tuned. I'm sitting with Dr. Netta Shaked in Miami Beach, and we're in her office. She is a psychologist. She's been dealing with patients for over 15 years, and she deals with women that have postpartum depression. And today she's going to tell us about postpartum depression and how to deal with it. Doctor, thank you so much for being with me today.
Thank you so much for having me.
Pregnancy and having a baby is such a beautiful thing. And I've been dealing with pregnant women for, at this point, 10 years, since the year 2000, and it's always so nice to deal with them. But there are doomy or gloomy parts of it, aren't there?
Indeed there are.
And that's postpartum depression, which we have heard for a long time. How does a woman know that she has postpartum depression, and or how does a spouse or a partner know that his wife or his partner has postpartum depression?
Well, it's a great question that you raise. One of the organizations that I deal with, Postpartum Support International, their mantra is, regarding postpartum depression, you can't tell by looking. Meaning that a lot of times women with postpartum depression might experience significant symptoms on the inside, but somebody from the outside just won't be able to tell.
This definitely affects the dynamics of the family.
Oh, indeed.
How does it affect the bonding with the baby or the relationship with the husband or other family members?
Sure, that's a very, very important issue to raise as well. Well, we know for a fact that the bond with the baby is impacted. A mom who's suffering from postpartum depression might not want to be with her baby, might even have thoughts of harming her baby or a feeling like she wishes she didn't have her baby. This obviously impacts the bond. In terms of how she would relate to her partner, oftentimes the partner might pick up that something is just off. Mom is just not doing well, she's excessively tearful, she's not really empathic towards the baby, and the partner might try to assist, but might just fail simply because the partner might not have the tools to help mom through this period.
Is there any predisposition for women to get postpartum depression? In other words, do more women in the Middle East, let's say for example, or in America get postpartum depression as opposed to Latin America?
What we're seeing in the research is that women across the world have the same rates of prevalence for postpartum depression. And what we know today is that about 20% of women who are pregnant will have postpartum depression.
Do you know if there are any nutritional factors involved in postpartum depression, or is it just something that can hit anyone?
It can hit anyone. A woman who's had depression in life prior to being pregnant is more likely to have postpartum depression. A woman who is pregnant and is experiencing significant stressors might also be more predisposed than other women to have postpartum symptoms. But nutrition is actually a huge component, because oftentimes when one is clinically depressed, one doesn't eat properly, which feeds the depression and feeds the fatigue, and then, of course, a vicious cycle ensues.
How early on does a woman start having postpartum depression?
That's really, I like that you're asking that question, because I get asked that a lot, and I'm going to actually segue into what is baby blues versus what is postpartum depression. So about 80% of women will experience baby blues. Baby blues peak at about day 3 to 5 after delivery, and the predominant mood is still a happy mood, although she might feel tearful and sort of respond to stressors in an unlikely way by crying or by feeling a little bit more irritable. A woman who has postpartum depression will have a predominantly negative, hopeless mood, and she will experience those symptoms for at least 2 weeks. So a woman who is experiencing symptoms for 2 weeks is having a clinical depression, versus a woman who is experiencing symptoms for 3 to 5 days is having a baby blues reaction.
Okay, so now I realize that my wife has postpartum depression. Or as a mother that has already delivered, by listening to what you've said, it's been 2 weeks, I'm weepy, what do I do now? What's my next step?
Well, the next step is to first and foremost seek help. There are so many resources out there for women who are experiencing symptoms of postpartum depression. And there are many clinicians, psychotherapists, psychologists, psychiatrists who are now trained in treating postpartum depression.
Okay, so now she realizes, or I realize as a spouse, that my spouse has postpartum depression, and she begins to get treatment. How long typically does it take for a woman to break the cycle of postpartum depression to going back to normal, let's say?
Well, we see results as early as after one session of treatment. Most women come in for one session and they're already feeling much more hopeful. They're feeling like their reaction is very normal. They're feeling a lot less stigmatized for feeling the way they're feeling. But most women will respond to a course of treatment anywhere between 6 and 12 sessions long. Some women more, some women less. I also want to point out that a woman could experience postpartum depression at any point during the first year after birth.
Wow, that's quite a big span of time.
Indeed, indeed. So it's important to recognize that if you're experiencing symptoms later in the postpartum period, that also falls within postpartum depression.
Okay, so let's say a woman is not living in sunny Florida and she can't get in contact with you, or she doesn't live in the immediate area. In other states, are there support groups, or is there a general website or contact information that you may know of that a woman can look up so that she can contact a professional in her area?
Well, first of all, I do therapy via Skype, the internet, chat, and telephone for women who are across state borders or just sometimes can't get out of bed to come to my office. They might be after a C-section and they're not mobile yet. They might be overwhelmed with a baby and can't drive to my office. So that's always an option. But aside from that, there is Postpartum Support International, which is really a fantastic organization that provides a lot of resources for women in different parts of the country and connects them with therapists in their particular region.
Doctor, is there anything that you would like to say to the women out there that are listening to you?
Remember, you're not alone in this, and there is treatment. Please do yourself a huge service and look for a clinician who can help you through this tough time. You'll be okay in the end, I promise.
Doctor, I really want to thank you for having joined me today and giving us such important information that you've given us. Thank you so much.
Thank you too. I appreciate it.
It is amazing how something that can go so unnoticed can affect not only the family dynamics, but you as well. It can affect you and your baby, the bonding between both of you. So make sure that if you experience any of the things that Dr. Netta Shaked talked about, please make sure that you get checked, speak to a professional, and don't let it go. That's it for the Painless Childbirth course, session number 7 today. Next week, we'll get together again for another wonderful session. Thank you so much for being with me this week. Have a great day, and make sure that you take care of yourself.